Hi, it's Colleen Schmidt from Divination Counseling Service, here today to present more medical astrology. I actually had somebody call me about a kidney issue and thought it might be really good for the website and for the YouTube channel. So I thought, okay, I'm going to stick with medical astrology for a minute, the way I did with history, the way I do with diurnals, and we'll probably jump back to that stuff eventually. I'd also like to look at rectification, but I have to look at those things down the road because one of the things that I do as an astrologer is I do medical astrology. I also do counseling astrology, but more recently, I've done several medical cases, and I thought that it's a little advanced for the website and for the YouTube channel. And yet I thought, you know what? There are probably a lot of astrologers out there that might be very, very interested in how we utilize the asteroids, particularly in medical astrology. We also use them for rectification, but medical astrology, there is a real need. Medicine has become very specialized. And just studying cancer, the disease cancer alone, has been an eye-opening experience because, first of all, I've studied anatomy, just general anatomy, several times. And I've come to the conclusion that everything in the body is related. Everything is connected. Even by placement of the joints, which spiral in opposite directions, going the other way, each time, each joint. One joint goes one way, one joint goes another way, one joint goes another way. So everything is connected. When you get into things like medicine, you begin to understand that even medicine, things that are supposed to be good for us, have implications. They do not stay only in their lane. They encompass so much more, sometimes negatively, sometimes positively. But everything permeates so that no matter what is going on, if you're under a lot of stress, it is going to equate into a health factor. There are so many things that ultimately can make us sick that we may not even realize, emotional things that can make us ill. Stress, as I mentioned, makes us ill. But I'm not talking about short-term illnesses. I'm talking about long-term chronic issues that can even lead to more terminal matters if they are not addressed. I mentioned earlier in the medical that the way in which we look at the general health of a human is to, of course, study their sun axis, all 4 points. So when I started with this individual, I did look at the sun axis only very briefly. I am going to admit that you're working with a lot of asteroids, thousands, and you're going through this thing and you're picking out all the sun aspects, and a lot of stuff isn't going to apply. So there's a lot of elimination that happens anyway. But I can tell you that this individual had inflammation, RA show up many times, which is, rheumatoid arthritis, and autoimmune. It also had matters leading from blood to heart. It also has sins, the bladder. And I highlighted it because this is a kidney issue, and the bladder is directly related to the kidney. We're going to look at the axis and how I did that in just a minute. But the way in which you want to look at any illness is sometimes you want to go right to all of the asteroids that are related to these illnesses. And I'm just going to give you a few. Attila for urinary and bladder. Sheldon Marks, also bladder. Sims, which is in this particular case, not only is it highlighted in the sun axis, but it's also literally about 2 to 3 degrees away from our kidney asteroid, which is, and here we go with me not being able to pronounce, Zandanging. So we have ZHANG I'm sorry, yeah, I was right. ZHANGDANGING. Yep, try that one. That's our main asteroid that I'm going to be working with the most. And I'm going to point out different things that we were able to see with regards to this illness. Okay. I can tell you that I did leave in things like, is it Montaigne? Montaigene. And it refers to an acquired immune deficiency syndrome. Okay, now remember that even in the sun axis, we already see asteroids that tell us there's an immune issue. And here we go again with we need to understand what affects our immune systems because it can lead to so many other issues. Okay, so I do want to go into that. I'm going to also be pointing out some other kidney disease issues, such as Roundtree, Roundtree, which is for dialysis. Okay, and one of the things that showed up in this axis, and this tells us a lot about what's causing this, is um, heavy metal toxins, Albertus Magnus and Hermann. Okay, so there's two. So then you start to think, wow, maybe part of this kidney issue has something to do with environment, possibly foods that are being eaten, but there's something that's causing the immune system to be compromised. And it does look like heavy metals, which are toxins, could be a factor. I also am going to talk about all kinds of inflammatory issues that can also exacerbate things. For example, one of the issues is an RA factor. I'm sorry, arthritis. I do that all the time. And it's called Holman. And then we would also be looking at DUMES, which is for sugars, because if you have a kidney or a bladder issue and there's a heavy metal issue, consider sugars. It just turns out this particular individual is diabetic. Okay, so you can see how the chart just like brings that up. In addition, we're going to be looking at Gram. Okay, Gram, which is another urinary factor. So there's quite a few things that we can look at, and some of them will not really show up. Others will show up in threefold. I'm thinking, for example, Gram. I do not believe Gram showed up. However, everything else did. And there's Wallace, which is another one. So we go through, and it's a lot of research. It's a lot of learning, but I did come up with a really strong axis that tells us a great deal about this particular kidney disease, perhaps even what's causing it, and how it's really affecting the stomach, how it's being exacerbated by RA, rheumatoid arthritis, okay, and inflammation, which shows up also not only in the actual kidney factor itself, but also into the sun axis. So I want to look at all of these things. And interestingly enough, dialysis and catheter both show up here as well. So this is very serious. This is a very serious issue for this particular individual. And one of my big concerns as a person who would talk to someone about this would be that there could be um, carcinoma type cells that could ultimately cause cancers in the bladder. And so this is something that I would tell them. I would say, do you understand that the cancer markers are very great and that it's something that you would want to keep in mind and want to make sure that you were keeping control of your diet, because inflammatory factors are often the result of diet. I would probably, if I were doing private work for this, now we're only going to be doing this on one subject. So I'm not going to I'm going to stay in my lane basically when we get into the chart because I don't want to overwhelm you. But as an astrologer who does this work, I would be looking at the fact that sugar is a source of inflammation and that diabetics who do not stay on their diets are throwing their system into greater jeopardy. And that's probably the first thing I would talk about. I myself, I'm not a diabetic. I've been borderline diabetic, and I'm not lying when I say this, my whole life. Okay. When I was 18 years old, they realized that I was a borderline case. And diabetes does run in our families, but it tends to be something that happens only when you get older, which is a testament to my being borderline. Fortunately for me, I grew up with very health conscious parents, and both of which were athletes. So I grew up and I became a dancer. So I grew up very health oriented, health conscious. I dropped sugar as much as I could for my diet. And I'm happy to report as a 60 something that that number has not changed. Okay. That's what I encourage a lot of people to do. If you know that something isn't right, that something is off, keep an eye on it. Do what's necessary to not make it get worse. And that would be how I would instruct this particular person. Actually, I am instructing this particular person to really consider their diet and the fact that eating the wrong foods does cause inflammation. But inflammation can also come from stress, other medicines that you're required to take, and the heavy metals. Okay? So I love doing this work. I am not a doctor. I will say that over and over again. I've never studied beyond anatomy. And but I will tell you that the studies that I have done on the individual charts has really enlightened me to how complicated medicine really is. And one of the things I thoroughly believe. Now remember, in the day and age of Kepler, in the day and age of Nostradamus. So we're going back to what, 500s, 400s. Okay, you had to be an astrologer or you weren't a doctor. Well, I think it's coming to a place now where astrologers are going to become important to physicians. I think everything's gotten so complicated, I don't think doctors could begin. I mean, I'm sure they could study astrology, but they've got so many other things they've got to study. I study astrology. When I look at a chart, I don't even need to know your name. When I begin to dice up and slice up the chart, yeah, I'm going to find what you're prone to. I'm going to find where some of the weaknesses are in your system. I'm going to show you where you might want to focus some attention, just as I will be doing with this particular individual. Okay, so let's look at the chart. Once again, I'm only going to stay in my lane. I am not going to talk about other factors that could interject or inject into this, nor am I looking at where all of the little spidery things that leave this arena could affect others. Remember, Holman did not show up in our original. However, I could have gone back and done a whole axis for that just to gather more information because he still has one. It just didn't fall in those axes. So this is one of the things I really try to emphasize, particularly if people are going to start using the asteroids. There's just so many of them, and there are many in terms of groupings. So when you're looking at urinary and bladder and that system, it has its own asteroids. Fascinating field, medical astrology. I have been enamored with it for decades. And I have only, because you learn so much, I think I got my brain tumor book when she first wrote it, probably 20 years ago, maybe more than that, 25 years ago. I can honestly tell you that it's only the last 5 to 10 that I started getting my feet wet in medical astrology. And I still touch base with my teacher when I do medical work just because of the importance of it, the significance of it. You really don't want to miss anything when you are looking at medical work. It's the same as if you were a doctor. You wouldn't want to miss anything. And you particularly would want to know what tests were valid to whatever that illness is. So with that said, let's jump in here. I've been talking long enough now. Let's jump in and look at this chart. I'm going to look at it in the chart itself, but the most important part of any work that I do on astrology, and it's simply because we are talking asteroids, we need to use a dial. So with that said, let's go grab that chart. So here we have the chart, and there's so much stuff in it because I really work with a lot of things. Sometimes I look at my own charts and I'm like, but not all the asteroids are here, and certainly not the medical asteroids, other than we do have health asteroids all over the chart. And of course, we could always look at, health asteroids because there are so many. Just to pick out just a few so that, we can at least start to look at some of this. First of all, when you're looking at Eros, we're looking at heart and reproductive, okay? But here we go. Okay, so let's talk about this for just a second. So you have an Astrea, okay, about 2 degrees away from a health asteroid, one of the many. And it kind of infers to the fact, and this is very true, I happen to know this person, that there are health matters that there are no resolutions. And I think we are hitting on one today, okay, where it's just this stuff where you manage it rather than being able to eradicate it. Okay, so there's one. Now you can go through, and a lot of these can equate out. Like this is an important one because it does show up within the sun axis by 3 minutes, but it shows up. And it is telling us that the heart, the blood are things that he would want to be alerted to. Okay, so moving on, I'm just kind of going through this. Here's another one. Pain level. Yeah, that's pain. Okay, and your Uranus. Okay, now just to kind of reiterate this a little bit. Okay, they both show up at about 6 degrees of fixed. So we know that this is a man who struggles with discomfort, possibly pain. It's a struggle. It's a struggle, and it is conjunct. But this is what I want you to see. Look at that. 4 degrees away. It's 4 degrees away. But at 10 degrees, you have industria. That's your work. It's your productivity. So we know that this affects probably his productivity. I would also venture to say that that I would, the industria he, as far as I know, does not work with chemicals. So we can't say that it has anything to do with that. It's 4 degrees away. Some astrologers would say that's in aspect. Others might not agree with that, depending on what kind of astrology you do. Okay. So just coming along, and it's amazing, like this 15 degree of, that's your brain psyche, but it's also a factor, as we know, for aphasia. It's a factor for mental illnesses, mental health. So just to let you know, there just isn't a lot. I don't really work medical when I'm doing this kind of work. So this is more of my counseling list, is what I call it. But you can see, here's another one. And it's interesting because it conjuncts Lilith. Not Lilith, the asteroid, that would be here. But it would be Lilith, the moon, black moon. Okay. So they're both together, which, would get me to wonder how much of this physical health and the ability to even take care of oneself, it's hygeia, okay, which is health and well-being. But the well-being part is a bigger emphasis, at least for me as an astrologer. But I think, wow. So this person came in with maybe ideals or genetics, health issues. So there's a couple of things there that would be worth looking at with regards to health. So, like I say, there's others. I'm not finding, they're not jumping off the page. I already went through that one. I thought there was another one like that one, so I'm missing it. But again, this is not, I'm not doing anything other than health on this. So I didn't really want to spend a whole lot of time. Let me do this. Here we go. I got to go to asteroids. See, there's actually reports for asteroids. Okay. Here, now. I thought there was more than one, just a scapula. I thought I had more in here, but apparently I do not. So in any event, you can't really look just at a plain chart, at least not mine, because I don't really put those asteroids in so much, okay? But what we're going to do is we're going to switch this, okay? Now, the first thing I do want to point out is that this is an Aries point chart. I actually have several clients that have what I call Aries point charts, which is kind of cool because that means some of the their main axes are the Aries point, and it makes it really easy because I'm an Aries point. I look at the Aries point all the time regardless. So this case, we are looking at an Aries point sun. So this person has an Aries point sun, and not far away, we see Valentine, which can represent blood or heart. I definitely can tell you that I think that there could be some heart factors. I think that this is something that we already know about this chart. Okay. So I didn't go real far into the Aries point when it came to I don't know if you can even see any of this, but 4 pages, I don't know if you can catch this, of lists. Yes, I use recycled paper. 4 pages. That's what I have to go through every time I look something up, okay? Oh, and did you note that there are 3 marked off sections on each page? That's what I do, okay? So that's me. Yep, every page has. So what we're going to be doing is we're going to be looking into those little sections that I have already marked off. I think you can see them too in blue. Okay. Blue. All right. I know you can't read it. It's too small. I can hardly read it. But that's how I get, that's how we can get this many on a sheet. Okay, so I'm going to kind of show you first what the axis is that I am going to be looking at. I only stayed with the one because it really had a lot to say. So I thought, I'm going to do this. So this is, I'm just going to show this out to you mathematically. Okay. As a matter of fact, I think for this, I can grab the pen. Okay, I'm back. And so we have the Aries points up there. I didn't put any arrows on these numbers. So with these numbers, I'm going to kind of write them all in. Okay, so the actual asteroid itself is 152 mutable. So it's right there. That's our highlighted. And just so that, I don't know if I can do this, ZHAN, this is just so you know, GDA, N, I think it's a, yep, G, I, N, G. Okay, that is this. This whole axis of everything I'm going to show you is going to occur at the 4 points that I'm going to have listed. So now we're going to go 1, 2, 3, 4, and right here. And you notice that as I put the second point in, it does highlight points on the chart. Okay, I believe it's Volcanus and Apollon. Or is it? No, I lie. It's Astrea. Okay, it's Astrea and Volcanus. Okay, so there's a lot of pressure because there are no resolutions. Okay, so that's our second spot. And then you can see that it affects, that's where we see that Astrea again, remember? Now, we also are going to be looking at 1652. 1, 2, 3, 4, 5, 6. Not far from Vesta. And this is Vesta. And remember that one of the first things that I talk to clients about is how much they're sacrificing themselves and their bodies for their jobs. I've seen a lot of people do that. Really, really just give up their health for their jobs. I am obviously not a proponent of doing that. And we're also going to be looking at 922 right about here as our fourth location. So I have to get these numbers. This is so important, okay? 152. This is how I work, okay? And I think I've showed you, and that's mutable. The second one is 2230 away, which would make it 2422. Okay, mutable. Okay, from there, I came over and I did 1652. And you could go back and do this math if you're, I would recommend it if you're uncertain or if you think I've made a mistake. And by the way, me making a mistake, oh, that's like so normal. And this is 922, and this is fixed. Okay? So those are going to be where all of the information that I'm going to be giving you now comes from. Just those 4 places. And I try to narrow it down to like a degree, literally that close of an orb. If it's a little outside or, I'll let you know, because sometimes they just go together. And I think that there's a relationship because of what it represents. And I'll say, okay, I'm going to let that one stay. Otherwise, what I do is I go through my list of 4 pages and I eliminate all of the things in the axis that we don't need. Okay. Because they're not They are applicable. I've already proven that to myself, but I'm not going to go into all the ways they could be applicable. Okay, because then I'm just getting crazy. All right. So under the Zhang Danging asteroid axis, we have Alona for inflammation, Sharp for inflammation. I already talked about Montaigne for an acquired immune deficiency syndrome. And look at this with the Astrea right there, just highlighting it, covering it all up. So, yeah, okay. So then it goes on, and we've got Schumacher for urinary stenoma. We get Kaplan for urethra, but also the bladder. Dialysis, okay, and also kidney symptoms and kidney disease. So it doesn't mean that he'll necessarily be eventually on dialysis. I wouldn't necessarily say that. What I would say is it's in the axis. You want to be very, very careful of anything that would cause inflammation or that would affect the immune system. Okay, so he did get some good news. I'm going to get to that in a second. So as we go through, I did talk about Connors, which is again rheumatoid arthritis or inflammation. So I'm going to keep doing that. RA, inflammation, RA, inflammation. This particular individual, this stuff jumped off the pages. Okay. I talked about the heavy metal asteroid of Albertus Magnus and Hermann, which are also listed as things that can affect the kidney. Okay. Prometheus also is in this axis. And what's interesting is, remember how I pointed out that Uranus wasn't far away from? Well, Prometheus is another Uranus, but this case it's an asteroid. It acts like Uranus. So you think of what does Uranus mean? And Prometheus is right there. Okay, so it's unpredictable. It just is sudden. So all of the things you would think about with Uranus. The good news, Prometheus is in retrograde, but which means it doesn't act like it normally would. But I find that sometimes retrogrades only exasperate matters. And speaking of retrogrades, he also has Vircho, which means there is a pathology. Okay, which means, again, Astrea, it's getting worse. Crane is representative and this is something I would recommend. See, this is the stuff you find that gives you the solutions. And I've done it in my own chart for my own issues. I have stomach issues, and boy, I've been able to find things, and it really worked out. Okay, I listened. It said vitamin C therapy. Guess who's in vitamin C therapy? That's right, this one. Because it really works for me. Doesn't necessarily mean work for other people. In this case, this chart tells me that COQ10, something I actually very much endorse, very good for the heart. Anybody who has to take statins better be on this so they don't get the side effects of those statins, whether it's a natural statin, which would be red yeast rice, or whether it would be one of the statins that are out there on the market. COQ10 is something that absolutely reduces those side effects. And speaking of which, I don't know whether this individual's on statins, but it would be a very good question to ask, simply because there are side effects of statins that will plague some of these things. So here we go. So COQ10 for this individual is a cure. It's a cure. In other words, I'm not saying it's going to cure and make it go completely away. What I'm saying is, if you want to hold off, just like my stomach, I'm not ever going to have a great stomach, okay? But if I can reduce the inflammation on my stomach, I won't get so many holes in my stomach, okay? This is true of this individual. If this individual were to take the COQ10, and I am going to advise it, it will help. Okay. And maybe he already takes it. I don't know. It is definitely worth looking into. And that asteroid is called Crane. Right below, and Crane is direct. Okay. He does have Holmberg here, which I also said is an RA factor. Yes, rheumatoid arthritis. I did mention that it was already in there. But Sano is also, it's not far. It's out, but by only a few minutes. And it indicates cures or things that can help. COQ10. Okay. So it isn't always bad. We're not always looking in there and saying, oh my God, this is terrible. No, it's not like that. There's always some way that we can alleviate it if we're willing to do the work, if we're willing to look at the chart to see if that's a possibility. Now, I shouldn't say that because I know that my teacher, Martha, has also mentioned working on cases where there is no cure. And she has to break that news. Sometimes I remember the last time it was parents of a baby, and the baby wasn't staying. And unfortunately, it doesn't always work. But for most of us that have been here any significant amount of time, there usually is something in there that will counter whatever it is that's gone bad. Here's another one I can't really say. Excubator. It's basically something that lets, it's like an alarm, okay, in the system, our bodies, we all have them. And in this case, it's an alarm to the immune system. Now, here's a case where that is a retrograde and obviously is not working as well as it should. Then we've got Morgan for inflammatory disease. We've got Wallace for urology and urology cancer. So again, you always want to be highlighting what could turn into a cancer. Now realize there's also things like stuff that also counters cancer in us, all of us. Like there are there's stuff inside of all of us that can also reduce tumors. It's a matter of whether it falls in the right axis of whatever the disease is. Okay. So I do want to point that out. But I would always be alerted for anyone who had cancer, red flags. And we all have it because I'm studying from thousands of asteroids that we all have that resides in each one of us. It's so interesting. They always said growing up, everybody has cancer in them. It's whether or not that turns into the disease. That is the absolute utter truth. Everything I'm reading to you right now, you also have in your chart. Does it aspect the same way? Probably not. We're all so different, but we all have it. We all have Zandangine in our chart. Okay. Schwartz for diuretics. I do believe that this person is taking diuretics very, very hard on the kidneys, but yet it's probably for something else. So this is the stuff that you need to put together. And by the way, I'm the type of person that will do charts and then go to the doctors and say what tests I'd like to have them done. So you can do that as well. Larson tells you that there's an abnormal amount of white blood cell protein produced by some of the bone marrow. Generally, it's not a problem. However, it can cause kidney issues, and it's in his kidney axis. That was a real biggie for me, okay? It does talk about, again, carcinoma that could likely be found in the bladder is also showing here. I Again, I'm not going to say, oh, yeah, this is definitely no. I wouldn't say that because you can't even imagine how many cancer asteroids there really are. You just, it would be mind blowing. So sometimes I do skip them. I will always let the client know, but I always let, just as I'm letting you know, when there are tons of them, you're going to hit them. I mean, they're going to be there. Um, Interestingly enough, Robeson is there, which could also be the removal of a kidney because of kidney disease, damage, or an infection. Um, the Flamus is there for inflammation, and Schmidt for inflammation, and Gutman for catheter. But I do want to point out that Gutman, interestingly enough, this is another individual with gut issues. So, but again, do they tie together? And this is what we would be looking at. So let me come on back, and we'll go through this. So I'm back. Oh, I'm back. I'm not going to make that mistake. What I do want to come back in to kind of just sum this up. This is a real case, a real person. On Friday, I have another video that will also be a real case, real person. That one's going to be really complicated. I really can hope that I get my point across. What I want to show on that one, and these are real people, is that this individual has a disorder that looks a lot like another disease. So but it's not. Okay. So it'd be really interesting. As a matter of fact, I learned about a new disease. I learned about that disease from doing that chart. I had no idea in that respect. Let me just get that for a second. So here I am. Okay, it's multiple myeloma. Okay, so the disease that I'm referring to is called mungus. Okay, never heard of it before, but I'm doing this chart and I'm like, it's like multiple myeloma, but it's not multiple myeloma. So hopefully I'll be able to really go through that one with you. That was kind of exciting for me because not only did I beat the doctor on the diagnosis, but I learned about a completely new disease, which I know it sounds weird, but it's kind of exciting. Anyway, with that said, I hope you enjoyed the video. I know that the work I'm doing now is getting awful complicated, but I do hope that I'm able to educate, especially those of you who are already dabbling in astrology or studying astrology, or might even be a professional astrologer, but you just don't work in medical astrology. So hopefully this was informative and you actually learned something. That's my goal. With that said, thank you for watching the video. Oh, and my goodness, I never thanked all of my subscribers for all of their help in building this channel. So please forgive me for my remiss in my moment of gratitude. Thank you all for helping me with this channel. And until we meet again, as always, I wish you only happy readings.